morning from Sri Lanka, ladies and gentlemen. It is both my pleasure and my privilege to speak to you as we move on to a key event of the agenda for this meeting, and that is the Professor Walter K. Patrick Memorial Lecture. Professor Patrick spearheaded the formation of the Asia Pacific Academic Consortium for Public Health and provided leadership during the following 3 decades. I am pleased to introduce the head table who are with us today in Colombo, Sri Lanka. Professor Indika Karnatilaka, Vice President of APAC and President of the Sri Lanka Medical Association. Professor M.C. Veerasinghe, who is Professor in Public Health of the Faculty of Medicine, University of Colombo, and Vice President of the Sri Lanka Medical Association, and Mr. Angelo Patrick, beloved brother of Professor Walter K. Patrick. I am also pleased to introduce the chairpersons of today's sessions, Professor Bruce Maycock and Professor H.Y. Chiou, who have been very closely associated and working very closely with Professor Walter Patrick during his tenure and leadership at APAC. Before we commence the memorial lecture, I wish to request the dignitaries at the head table to make the opening remarks, and I wish to request Professor Indika Karnatilaka to commence the proceedings.
Welcome and good morning from Sri Lanka. Today all of us are joined here as well as worldwide to commemorate a very important, precious person who has been a mentor for many of us, Professor Walter Patrick, who has done yeoman service to APAC. It was 8 years ago in 2012 that we were gathered here in this very hall in BMICH for the concluding ceremony of the APAC 2012. 8 years down the line, we are gathered in the same venue for the inaugural Walter K. Patrick Memorial Lecture. So it's an important as well as sentimental moment for us. And in honor for a great person who has done a yeoman service, not only to APAC, but for the whole world community as well.
Thank you, Professor Karnatilaka. I would now like to invite Professor M.C. Veerasinghe to make the opening remarks.
Very good morning to all of you from a beautiful country of Sri Lanka. This is a historic occasion, I think, where we are honoring a person that we need to honor. And Professor Walter Patrick actually was an inspiring figure in public health in this region and for us in Sri Lanka. And he was actually bringing all those who were public health practitioners and the educationists in this area to a family where we could work together, we could contribute together, we could network together for a better world. And this is a historic occasion, as I am telling again, because we are honoring a person and we are remembering a person who really kept APAC together. So I hope that this event would continue at each APAC conference from this moment. Thank you.
Thank you, sir. My next invitation is to Mr. Angelo Patrick to make the opening remarks.
Thank you very much for this invitation extended to me, by which I am greatly honored. I, of course, am least qualified to speak about my brother's medical profession, but all I can contribute is how he managed to get into this medical profession and service to community. He decided to enter the medical profession at the age of 13, pure and simple because of a grave illness which was faced by my mother. And because of the lack of medical professionals at that time, or medical service at that time in the village that we come from in Maycock, Walter at that time made up his mind, I will become a doctor. Having done so, he entered medical college and passed out as a doctor. And his preference at that time was to become a plastic surgeon. And there again, fate intervened, and he was exposed to a patient in the plastic surgery unit where that little girl was a victim of a burn injury caused by what you call a bottle lamp, which is used in poverty-stricken rural areas. So Walter was exposed to that tragedy, and he felt that it is that area field that he should be getting into community medicine for purpose of education of people in public health. So that is how he evolved into this profession of public health. So thank you very much, Professor Indika, for the invitation accepted to me, to represent the family, and I'm much grateful to you. Thank you very much.
Thank you, sir. I now call upon co-chair Professor H.Y. Chiou to make the opening remarks.
It's my honor to have a co-chair for the Walter Patrick Memorial Seminar. I first met Walter Patrick around 2007. I give it a very impressive for him, for his energetic spirit for me. This I first joined this warm family of the APAC, and I chair as the Secretary General of the 41st Annual Conference of the APAC held in Taiwan. And during that event, I learned a lot from the Walter Patrick, and I learned about how he's very curious about the people, the public health, and in the Asia Pacific area. So at that time, I learned how to care about the people from the global view of the world. So I'm very happy, and I'm very honored to have this opportunity to chair this section. Thank you.
Thank you, sir. I now call upon co-chair Professor Bruce Maycock to take over the proceedings and to make his opening remarks and introduce the distinguished speaker who will be delivering the lecture today.
Aloha, everybody. And for those who know Walter, they know the importance of that greeting. I am very privileged to be here to do the introduction and also to co-chair for two great men. And one of the things about great men is that they leave a legacy. They create a legacy. And Walter's legacy was the way in which he engaged so many people in the APAC family. He never let you sit on the sideline. He always pulled you into conversation and communication. And one of his great friends was my mentor and a man who has done a lifetime of service to Australia and to this region. His contribution to health and well-being in Australia and this region is first class. And he was a man of firsts. He created the Curtin University Health Service. He created the School of Public Health at Curtin University, which was ranked in the top 100 to 150 in the world. He was the founding director of the National Drug Institute. He is a man who has published more than 600 papers, and at the same time was the founding editor of the Asia Pacific Journal of Public Health. Like Walter, he is a man of great integrity and driven by compassion. And I can think of no one else better suited to give this memorial lecture than Professor Colin. Back to you, Indica.
Thank you very much, Professor Bruce Maycock, for your opening remarks and introducing the orator. Now, can we invite Professor Colin Binns, John Curtin Distinguished Professor in Public Health luminary with international fame and long-standing colleague of Professor Walter Patrick. Over to you, Professor Colin Binns.
Well, thank you very much, gentlemen, for your kind introductions. It's a great pleasure of mine to be invited to give a speech in honour of Walter Patrick. He was a colleague, he was a friend, and he was a mentor for us all, and he was a giant amongst public health. Now, I'm just going to start my screen, and we'll be underway. You may find it strange that I start this with a bento box, but I first met Walter in Hawaii in 1988 at the first APAC meeting that I went to. And at lunchtime, he took the group of us, along with Professor John Hayakawa, down to a local park where we sat under some shady trees, and he distributed bento boxes. It's my first introduction to Japanese food, and it was delicious, and I've been enjoying a lot of meals with Walter ever since. Now, I spent 8 years of my life working in a very remote area of Papua New Guinea amongst the Enga people, and it's the custom there that when you meet somebody and you always share some food, and after you've shared that food with the person, you always call that person by the name of the food. It just shows how important food is in a culture like that. So you may address your friend as banana or sweet potato. So really, I could call Walter bento. And here are a few pictures of Walter, some of which you may have seen already. And here we are in the famous Korea House at the Korean APAC meeting with all those beautiful girls. And of course, some more food that we shared. Now, one of the things which drove Walter was his attendance at the conference on primary healthcare held in Alma-Ata in the Soviet Union, which is now Kazakhstan. Dr. Halfdan Mahler, who was a great director of the WHO, said at the time that Alma-Ata was one of the rare occasions when a consensus between the haves and the have-nots in local and global health emerged. And oh, for those days to be repeated again, because now we seem to be in a situation where all countries are striving for themselves. The one exception is the collaboration that is a hallmark of APAC. Walter was a great supporter of the Alma-Ata conference and its outcomes, and he subsequently wrote in an article in our journal, "The World Health Conclave held in Alma-Ata was the landmark beginning of global commitments to the shared goal of health for all by the year 2000. He emphasised the importance of child survival, of children, as the basis of public health. And he was appointed the editor for child survival for our journal, the Asia Pacific Journal of Public Health. And that tradition continues. And it's interesting that the most highly cited paper that we've ever published in our journal is one entitled The Long-Term Public Health Benefits of Breastfeeding, which to date's had 276 citations. And at the APAC meetings in recent years, we've continued to run workshops on the importance of public health nutrition, particularly as it applies to children. And in our journal, we have published articles on dietary guidelines, the APAC infant feeding guidelines, and the APAC guidelines on complementary feeding. And these really have been a continuation of the legacy established by Walter. And just to remind you of the importance of early childhood, WHO and UNICEF now emphasise the first 1,000 days of life from conception to just after 2 years of age as determining the pathway for good health for the rest of your life. So that if you are breastfed exclusively for 6 months, if you follow a reasonable pattern of growth, then you are much more likely to enjoy a healthy life and a healthy life expectancy. Unfortunately, we didn't achieve health for all by the year 2000, but there was great progress in the countries represented in APAC. And if we look at this particular chart, we can compare the last 50 years with the 1970 life expectancy and the 2018, which was the latest year I could get. And then we've got the improvement. All of these countries, in fact, have attended APAC meetings at various stages. And you can see that one of the remarkable things about this is that the countries which were worse off in 1970 have improved the most in their life expectancy. Now, life expectancy is, of course, the best indicator of the overall health of a population. So today I want to discuss briefly what does public health mean and how will the definitions and how will our teaching change in the era of the COVID pandemic, an epidemic which has shaken the world. The American Public Health Association definition is that public health promotes and protects the health of people and communities where they live, learn, work, and play. And I think Walter would have really liked the definition of where they live because he was always emphasizing the importance of culture and of communicating with people in their own language and in their own place. The Public Health Association of Australia gives a slightly different definition. Public health includes but goes beyond the treatment of individuals. It includes health promotion, prevention of disease and disability, and recovery and rehabilitation. And then we have the vision of public health from APAC to achieve the highest possible level of health for all of the people of the nations of the Asia-Pacific region. The mission of the consortium is to enhance regional capacity to improve the quality of life and to address major public health challenges through the delivery of education, research, and population health services. And that's what APAC is all about. Here are some other definitions of public health that I've come across over the years. Public health is the conscience of clinical and experimental medicine. And there's no better illustration of that than with the development of the vaccines against COVID. Public health has been continuously saying, let's be fair, let's make sure that all countries and that all people have access to the vaccines that they need and that the major multinational corporations do not use it as a profit-making exercise. Public health exists to keep big pharma under control. Public health is the guardian against those who would profit from illness. And public health ensures that claims on good health of the disadvantaged in our society are heard. The disadvantaged, of course, are those who live in rural areas, those who suffer from poverty, those who are discriminated against by means of gender or religion or some other discriminatory mean. So a modern definition of public health would also incorporate under health for all or universal healthcare, global or planetary health in its broadest concept. We can't live in a world which is rapidly deteriorating environmentally. For good health, we need to live on a planet which is itself healthy. So APAC values quality, effectiveness, efficiency, evidence-based medicine, and this reflects how we value good science. A core value of public health also has the education of health professionals and populations. And for those reasons, the disciplines of health promotion and health literacy are central to the schools of public health, and I hope are reflected in the articles that we publish in the Asia Pacific Journal of Public Health. APAC values learning and knowledge development, partnership and networking, capacity building and leadership development. And finally, we must add compassion to our core values. We add compassion because we are part of the healing in our community. We care for people. We consider their feelings. We involve their cultural beliefs. So public health, as envisaged by APAC, values respect for diversity, equity, an ethical approach to life and to health, and collegiality. I mentioned the first meeting of APAC that I went to in 1988. One of the things that impressed me was that the University of Hawaii had a stack of documents on the table at the front. And at the end of the meeting, they said, these are the detailed curricula of public health subjects that we teach. Please take them. We want to share our knowledge, our experience with each of you. And it's something that we have promoted ever since. So COVID won't change the definitions and the value of public health, but it has reinforced our values. It shows that we need a continued emphasis on public health as an equal to curative medicine. There's no time now which has reinforced more than ever before the fact that money spent on curative medicine doesn't always result in good health. It cures an illness, but good health also needs the services and values that we promote: prevention, health literacy, health protection, etc. And here's a diagram that appeared recently, or in the last month or two, in the American Journal of Public Health, which shows life expectancy on the y-axis and per capita expenditure on health on the x-axis. And so you can see that countries like, for example, Vietnam, which is in this mess here, which spends around about this level, does pretty well with a life expectancy of more than 75. But here we have Japan with one of the highest life expectancies in the world, along with Spain. And they spend half as much money, or less than half as much money, as the US does, which, because of inequity in its distribution of health, doesn't achieve nearly as an effective outcome. And this is a diagram that I actually presented at an APAC conference in 2002, which basically shows the same thing, except this uses healthy life expectancy instead of full life expectancy. So in summary, public health is about populations and equity in the achievement of health, with a particular emphasis on prevention. And it's important that we embrace good science, compassion, and education. Let's consider the pandemic that we're in the midst of. Up to this date, we've had 68 million cases of COVID reported and about 1.6 million deaths. The actual number of cases is probably in the range of 300 to 500 million. We need to compare this with some of the past great epidemics. The great influenza epidemic of 1918, 101 years ago, caused about 40 to 80 million deaths, somewhere in that region. A country like Korea had 140,000 deaths in a population of 12 million. a huge burden. That pales in comparison with the Black Death, the plague that hit Europe in 1347. It killed an estimate somewhere probably around about a third of the world's population. And it only ended with the development of quarantine. Quarantine comes from a Latin word which basically means in this case, 40 days of isolation for all new arrivals, which was invented by the city-state of Venice. Here we have a picture of one of the great artists of the 20th century. This is a picture of Edvard Munch, a Scandinavian artist. Here he is. And he did a self-portrait of when he was suffering from influenza. It now hangs in the Oslo Art Museum in Norway. And here is one of the most famous paintings from the 20th century by Klimt. It actually hangs in the Belvedere Museum in Venice. It's called The Kiss. It would be well known to everybody. Gustav Klimt wasn't nearly as lucky as Munch, and he actually died in the influenza epidemic. It took a terrible toll all around the world. Here's the most up-to-date data that I've been able to get on COVID in our region. And what's remarkable about this picture is how well APAC countries, the Asia Pacific countries, have done in comparison with the rest of the world. And the rest of the world you can look at is the USA down the bottom and the whole world as examples. And you can see in the column on the right the death rate per million of population, and you can see how well our countries have done in comparison with the United States. Now, we have to exercise a bit of caution because there have been differences in definitions and testing methods and completeness of reporting. But generally, the APAC conferences, where masks are commonly worn and the population has respect for the health professions and follows public health instructions, it's worked. It shows the value of public health. The COVID pandemic has shown the inadequacies of current global health structures and available resources. Countries which have had too much emphasis, well, a lot of emphasis on curative structures, have not done nearly as well as countries which have had more emphasis on public health. Now, as we recover, as the economies recover, it's time to rethink the balance between economy, environment, and health. And we've got to look at, as I said before, global health and the health of our planet as we recover from this pandemic. So the factors, just got to get rid of this notice that's right over the top. Whoops. The factors affecting public health will include the massive economic disruption caused to the food supply, housing, medical workforce, and so on. And while we work hard to manage the epidemic, chronic disease and other public health measures still need to be controlled. For example, the rates of vaccines delivered in developing countries has plummeted. The non-communicable diseases that we need to emphasize, and these have fallen by the way in this year because we haven't had the resources. The promotion of maternal and child health, the continued promotion of healthy diets and getting rid of unhealthy diets, continuous smoking campaigns, alcohol consumption, physical inactivity. These have been put aside as we've combated COVID. And when we return to normality in 2021 and 2022, we need to make sure that we engage the whole of community in these so that we as schools of public health take on the multinational companies that are still promoting smoking and unhealthy foods. So I think that the ways in which we will change traditional teaching in public health include some of these factors. We need to continue to use epidemiology as a basis for our public health courses. We need to understand population health, but we will need more emphasis on the intricacies of case definition and case detection and data collection. Recent years, we've emphasised chronic disease, but we need to remember that the world still faces the prospect of further pandemics in the future. Health promotion, health literacy. These remain the key skills to communicate the practical actions that arise from our epidemiological studies. Now we face a huge problem of convincing the population to benefit from the COVID vaccines which are becoming available. We will need, because of the fact that the COVID vaccines don't appear to stop the transmission of infection, but they do stop the person who's had the vaccine from actually contracting a clinical disease. We will need to keep encouraging people to wear masks, to avoid crowds, and to practice hand washing and sanitizing into the foreseeable future. This will be important to control the pandemic. This is the role of health promotion. Biostatistics. We've been really impressed by some of the complex modelling that has been carried out, and probably the Institute of Health Metrics and Evaluation at the University of Washington has been the best example of the capabilities of these techniques. We need to include those in our teaching of biostatistics, not that we believe that all students will actually become involved in doing them, but they need to understand the technology and its limitations. Occupational health is going to have to change. We will need more emphasis on infection control in the workforce. The history of public health is full of stories of the heroes of the past who worked in leprosy colonies and so on, exposing themselves to danger. And the same tradition has continued with COVID-19. And the reports that have been coming into our journal are of situations where the death rates in health workers are at least 3 times as great as the general population. In other words, people have been giving their lives in order to save the health of others. But that really is not good enough. We need to study how we can better protect our workers. And then, of course, there's the increased rates of mental illness that have occurred as a result of COVID, of the isolation and so on. So we've had reports of increased suicides in some countries related to COVID, the loss of employment. Environmental health. Initially, everyone thought that with the economic contraction, there would be a decrease in pollution, and there probably is a decrease in visual pollution. But recent data shows that it has not reduced the atmospheric greenhouse gases. And that's because of the inertia which has been established over recent years. So as economies are re-established, we need to increase emphasis on improving our environment. Nutrition remains one of the most significant determinants of public health. The COVID epidemic has disrupted food supplies around the world, and many lower and middle income countries are facing acute food shortages. WHO, UNICEF, FAO estimate that something like 265 million people will face, will face food shortages by the end of this year. They estimate that there will be 130,000 more child deaths in 2020, mainly as a result of food shortages predisposing to other infectious diseases. There will be a 14% increase in moderate or severe wasting. In other words, 7 million more children will be suffering from severe malnutrition. And we know from clinical reports that subjects with poor nutrition, either undernutrition or obesity, are more vulnerable to all infections. Probably the nutritional intervention that's been used most during the epidemic has been the addition of vitamin D supplements. So far, we only have anecdotal evidence, and no trials have actually shown that that is a benefit. So we need some good evaluation studies. Maternal and child health has suffered. In some countries, it's virtually stopped altogether. WHO estimates that routine vaccinations around the world have declined by 60%. Now, for those of us who are of my age, I remember the days when we had hundreds, probably thousands of children dying in Papua New Guinea from epidemics of measles and whooping cough. That's something I never want to experience again. We need to find a way of getting those vaccinations to everybody, despite the appalling conditions brought on by the pandemic. Exclusive breastfeeding for 6 months. The epidemic has given the chance to multinational corporations to promote their formula by spreading rumours about the value of breast milk in the pandemic. Breast milk is by far the safest way to feed all infants through the time of the epidemic. In 1990, in a paper, Walter estimated that in Asia, 25 million infants were unprotected against measles. Currently, UNICEF estimates that it's about 11.5 million people. But during the pandemic, the vaccination rates have dropped, and there are now around about 40 million infants in Asia who are probably unprotected against measles. That gives us the potential for a massive epidemic over the next few years. Ethics has always been important in public health. The discoverer of the first polio vaccine, Jonas Salk, refused to take out a patent on his vaccine. He basically said, it belongs to the world. Now, all of the new COVID vaccines have been patented by the manufacturers. I hope that they don't use this as an opportunity to make large profits at the expense of the lower and middle income countries. I hope that WHO and the current COVID vaccine consortiums will be able to overcome this. For those of you interested in the distribution of COVID vaccines, the National Academy of Sciences has just published an excellent report. It was chaired by the former director of the US CDC, president of the American Public Health Association, Professor Bill Foege. He was one of the best CDC directors that there has ever been and is a real icon of public health. His report on the ethics of distribution and the basis of distribution is really worth reading. And to me, it's an amazing feat to get the thing published during the era of the Trump administration. So in conclusion, the COVID pandemic has shown us that medical technology cannot offer immediate solutions to major epidemics. And unfortunately, those epidemics are likely to hit our societies from time to time. We need to renew the teaching and practice of public health principles as they remain the most important way of protecting society against present and future health threats. And I believe that if Walter Patrick had participated in the discussion today, he would have reminded us of the importance of discussing culture and health beliefs and the value of caring for each other as we begin and before we begin a COVID health education program. Thank you very much for the honour of giving this lecture.
I now wish to invite all our participants who are joining us virtually to say aloha for a group photograph. So please be kind enough to switch on your videos as we take a group photograph, and the dignitaries in the head table as well. Please switch on your videos. Say aloha, ladies and gentlemen.
Aloha.
Aloha. Ah.
Thank you very much. We are moving on to the next screen. Please say aloha, ladies and gentlemen. Aloha.
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 Ah.
And the next screen. Please bear with us as we have over 100 participants online, and we would like to capture as many as possible for this group photograph. Please do turn on your videos and join us. One more time, please. Aloha, ladies and gentlemen. Thank you very much. I would now like to hand over the proceedings to Conference Chairperson, Professor Indika Karunatilaka.
Thank you. That was a beautiful tribute to a beautiful human being and a great person. So with that, we conclude the first Walter Patrick Memorial Lecture, and we'll be moving to the next session in another 5 minutes time, after 5 minutes break. See you soon. Thank you.